Hi, I'm Dr. Sean Wells, physical therapist and creator of nutritionalphysicaltherapy.com. I wanted to touch on nutrition as it relates to neurological physical therapy. Some really cool stuff out there in terms of what diet and food can do to patients with neurological issues. The first big thing that I can talk about is alcohol. Alcohol reduction has many benefits, metabolically, physiologically, and specifically, in this case, neurologically. There's a tailored, systematic review done showing that more than 2 drinks per day increase the fall risks of older adults. Moreover, there's a big risk with alcohol, and it doesn't have to be just large amounts of alcohol. It can be small amounts of daily alcohol with the generation of polyneuropathy, specifically B1 deficiency polyneuropathy. There's definitely some evidence out there that alcohol reduces healing and promotes inflammation in the body. As such, it's simple for a physical therapist to offer this nutritional advice of reduction of alcohol, whether it be a daily reduction, total abstinence, or at least providing space or days between days of drinking, particularly in those that have neurological issues. Another big hot topic within nutrition and physical therapy is the omega-3 supplementations. Soltani last year in 2018 produced a really interesting study looking at the Glasgow Coma Scale with the use of omega-3s following traumatic brain injury. It showed some positive benefits, but it's the only randomized control trial done in humans. So the other studies that have been done have all been animal studies or smaller cohort or case control studies. So the research is still out whether omega-3s can have a benefit. And there's also still some risks and things that we have to look at with omega-3s, and those risks being that a lot of those supplementations are sourced from fish. Those fish are laden with mercury, dioxins, PCBs, and other toxins, which actually may end up being deleterious to the patient instead of beneficial. As such, it's still too early for physical therapists or really any practitioner to be pushing or recommending omega-3s for a lot of neurological conditions, but specifically traumatic brain injuries. It's still way too early. Lastly, I want to touch a little bit about the power of fruit. Fruit is amazing for patients with neurological conditions. Fruit has not only interventional properties, but also preventative properties. Many physical therapists may know a little bit about the preventative properties. In fact, that there's neuroprotection with eating fruit, specifically for chronic degenerative issues like Parkinson's, dementia, and Alzheimer's. High intakes of fruit patterns, specifically to blueberries, raspberries, and other berries, reduces the odds of developing those diseases. Moreover, a high fruit content in a diet has been shown to reduce diabetes and other chronic related issues such as stroke. A real interesting study, this is more of an interventional side study, is looking at elder adults with mild cognitive impairment. A study done by Miller in 2018 looked at just adding 1 cup of blueberries per day, showed a marked improvement in cognitive functioning for older adults with mild cognitive impairment. That's significant. Those patients are out day to day doing functional tasks and being in the community, and just simply adding 1 cup of blueberries can improve their cognition and thinking, which may improve their motor performance and reduce falls. Really cool study. Another cool study with some PT-specific measures related to nutrition and neurology was the 2015 Schrager study that looked at balance and gait improvement in those eating blueberries and carrots. Really great study. Take a look at it. We have it on our blog post, and we have more on our courses and our resource page. So check them out, and hope to see you in class.